Hello friends, today I am going to discuss about the CET July 2022 papers, and I think this paper is between moderate to difficult papers. Okay, it is not too easy and it is not so much difficult. It will be categorized as moderate to difficult. So I am going to discuss about the CET July 2022 question papers, and the first question is about the one a deaminated methylated cytosine is. So I am just remembering it like as, in case of cytosine, it containing amino group. In case of thymine, it contain methylated group. And you know that thymine, cytosine and uracil, these are the pyrimidine group. Uracil is the pyrimidine group, and here we can simply look at, and in the purine group there is 2 rings and in pyrimidine there is 1 ring. So as they mentioned, just deaminated methylated cytosine, there is no any ring attachment, so we can easily rule out the adenine and guanine. And now just methylated cytosine but deaminated, so agar if we remove the amine and add the methyl group, this leading to thymine. Okay, so the answer should be thymine. Next is the maple syrup urine disease caused by all, and you know very well that it is due to branch chain amino acids and due to valine, leucine, isoleucine. So it is the methionine, as it is except so. Next is, it is a very favorite questions in NEET PG peoples also, and in INSET they asked it, and it is very common question. Type 2 leper reaction treated with, and you know it is very simple, just add the glucocorticoids. Okay, next, in cubital fossa, this is a arranged question, and from medial to lateral, and I just remember from medial to lateral it is as MBBS. So M is the median nerve, B is the brachial artery, B is the biceps, and S is the superficial branch of radial nerve. So simply A to B, B to C, C to D, A to B, to C to D. Okay. Next is the extent of drug absorption, and I think this question is very important, and it is simply area under curve. So if we draw a curve and we just look at this is the drug absorption. So this will show the area under curve is the total absorption, and I think previously this question has been repeated, and it is very important question. Okay, next is the sixth question is the manic patient on treatment since 2 years. Okay, and now she want to conceive, and most teratogenic drug, and whenever talk it is the most teratogenic, simply this should be valproate, because it can cause the spina bifida. Okay, next, I just can't recall the other options because it is as single one-liner question. N-acetyl parabenzoquinone cause hepatonecrosis is due to simple paracetamol poisoning. Okay. Next is which was not treatment of sickle cell anemia, and voxelotor and bebtelovimab and hydroxyurea L-glutamine, and I think this is L-glutamine. I am a bit confused, but I think this is L-glutamine should be the answer, because I think other hydroxyurea I know, but I too think voxelotor and bebtelovimab is used in case of sickle cell anemia. Okay, and this is one of the favorite questions of phospholipase C is act via simple GQ, and you know GS is via CMP pathway, and GI is the opening the potassium channels, and it is via the phospholipase C leading to IP3 and DAG. Okay. Next is the active metabolite of cyclophosphamide you have to remember this, and the answer is 4-hydroxy cyclophosphamide. Not first line treatment in case of rheumatoid arthritis, and you know methotrexate is used, sulfasalazine used, hydroxychloroquine is used. So answer should be azathiotromine. Methotrexate is used also, no? Next, a clinical case in which liver enzyme is elevated in a chronic alcoholics, and I can't recall the exact values. There is something gamma glutamyl transaminase is increased, and there is SGOT is increased, okay, and there is also SGPT is increased. So as it is increases in chronic alcoholic, so you have to give lorazepam is the treatment of choice in this case, and they have marked it like this is 1, this is 2, this is 3, this is 4, and just it should be 3 because it is from the third pharyngeal asthma, so it should be the, and I just remember is 3 as thymus, so absent thymus is due. It is also a recall question. And next is the anterior to posterior lung hilum relationship, and you have to remember this is as posteriorly from posterior to and this is the anterior. Anterior is the bronchial artery, then the bronchus, pulmonary vein, then pulmonary artery. This is the simple algorithm of relationships from anterior to posterior relationship of the lung hilum. And next is the which of the triad is seen in case of angle clause or glaucoma, and it should be the Vogt triad because it is seen in young populations. Okay, in young population when there is the there is due to exercise, it can cause Vogt triad, and I think you know about this triad, and this is the answer should be. And this is also a multiple question answer, okay, and acid first or ocystokinase is true, microleptor true, sperm true, P, so all is the answer. Okay, acid first, just you have to remember what is the others, please go through that. And next is the familial associations are in case of retinoblastoma, retinitis pigmentosa, and it is also multiple, and it is retinitis blastoma, you know, primary open angle glaucoma, you know, retinitis pigmentosa, you know, myopia, you know, so all of these above, okay, so everything is the answers. Next is the following is, this is something called as chromoblast, this is something as sclerotic body, sclerotic body. So this is the chromoblastomycosis, and this is also very favorite questions of INICET and NEET exam. And this is the also very favorite question like RK39. I just, you don't have to look the other options, RK9 positive, and this is something called as Kala-Azar, and you know the treatment of choice is liposomal amphotericin B. Okay, and in the exam the Lineweaver plot of this has been given, okay, and this is the competitive, and I think many students have find it difficulty regarding the remembering, and this value, this what is the Lineweaver, just go through this is the Kame plot, 1 by Kame plot, and I think I have remembered like that, if this is the plot and this is the normal and this is with the inhibitor, so this is the Kame of this normal and here is the Kame, so Kame is changed now. In case of competitive, Kame is increased, so simple, just Kame is changed, Vmax is unchanged, it is same, so you can see the Vmax 1 by Vmax is not changing, so it is at the single point in case of both inhibitor and non-inhibitor, so you can see, and here the Kame is changed, so this is the competitive inhibition. So friends, I have just tried to recall the first 20 questions of INICET of this 2022. If there should be any correction, I will mention in comment section, and the next is I will upload it. I just to recall, give me some time, and if you like this video, just share this video to your friends and give your feedback if there is any correction in any questions. So thank you friends for watching this video.